ovarian cysts? Well, these are fluid-filled sacs or pockets in an ovary or on its surface. Women have two ovaries, each about the size and shape of an almond on each side of the uterus. Eggs, ova, which develop and mature in the ovaries are released in monthly cycles during the childbearing years. Many women have ovarian cysts at some time. Most ovarian cysts present little or no discomfort and are harmless. The majority disappears without treatment within a few months. However, ovarian cysts, especially those that have ruptured, can cause serious symptoms. To protect your health, get regular pelvic exam and know the symptoms that can signal a potentially serious problem. Earlier on this channel, I have already posted a short video about ovarian cysts in short English medical videos playlist. You can watch the video, and today I'm going to discuss this illness in detail. Well, first of all, let me tell you the symptoms. Well, most cysts do not cause symptoms and go away on their own. However, a large ovarian cyst can cause pelvic pain, a dull or sharp ache in the lower abdomen on the side of the cyst, fullness or heaviness in your abdomen, bloating. You should seek immediate medical attention if you have sudden severe abdominal or pelvic pain, pain with fever or vomiting. If you have these signs and symptoms are those of shock, cold, clammy skin, rapid breathing, and lightheadedness or weakness, you should see your doctor right away. Now let me tell you the causes. Most ovarian cysts develop as a result of your menstrual cycle. These are functional cysts. Other types of cysts are much less common. Now let me tell you a brief about functional cysts. Well, your ovaries normally grow cyst-like structure which are known as follicles each month. Follicles produce the hormones estrogen and progesterone and release an egg when you ovulate. If a normal monthly follicle keeps growing, it is known as functional cyst. And there are two types of functional cyst. The first one is follicular cyst. Around the midpoint of your menstrual cycle, an egg bursts out of its follicle and travels down the fallopian tube. A follicular cyst begins when the follicle does not rupture or release its eggs, but continues to grow. The second one is corpus luteum cyst. When a follicle releases its egg, it begins producing estrogen and progesterone for conception. This follicle is now called the corpus luteum. Sometimes fluid accumulates inside the follicle, causing the corpus luteum to grow into a cyst. Functional cysts are usually harmless, rarely cause pain, and often disappear on their own within 2 or 3 menstrual cycles. And now I'll tell you about other cysts which are pathological. Well, types of cysts not related to the normal function of your menstrual cycle include dermoid cyst, also called teratoma. These can can contain tissue such as hair, skin, or teeth because they form from embryonic cells. They are rarely cancerous. Cyst adenomas. These develop on the surface of an ovary and might be filled with a watery or a mucous material. Endometriomas. These develop as a result of a condition in which uterine endometrial cells grow outside your uterus. This condition is known as endometriosis. Some of the tissues that can attach to your ovary and form a growth. This is known as endometriosis. Dermoid cysts and cyst adenomas can become large, causing the ovary to move out of position. This increases the chance of painful twisting of your ovary called ovarian torsion. Ovarian torsion may also result in decreasing or stopping blood flow to the ovary. So ovarian torsion is a dangerous condition. Okay. Now I will tell you the risk factor. Your risk of developing an ovarian cyst is heightened by hormonal problems. These include taking the fertility drug clomiphene, that comes with the name of Clomid, which is used to cause you to ovulate. Pregnancy. Sometimes the cyst that forms when you ovulate stays on your ovary throughout your pregnancy. Endometriosis. This condition causes uterine endometrial cells to grow outside your uterus. Some of the tissue can attach to your ovary and form a growth. So this is also a risk factor. Okay. Also, if there is a severe pelvic infection, if the infection spreads to the ovaries, it can also cause cyst. Well, regarding pelvic infection, commonly known as pelvic inflammatory disease, also if there is a history of previous ovarian cysts, then there is a increased risk of developing more. Okay. Now I will tell you the complications. Some women develop less common types of cysts that a doctor finds during a pelvic exam. or cystic ovarian masses that develop after menopause might be cancerous. Uh, that is why it is important to have regular pelvic exams. Infrequent complications associated with ovarian cysts include ovarian torsion. Cysts that large can cause the ovary to move, increasing the chance of painful twisting of your ovary, that is known as ovarian torsion. Symptoms can include an abrupt onset of severe pelvic pain, nausea, and vomiting. Ovarian torsion can also decrease or stop blood flow to the ovaries. Okay. The second complication is rupture. A cyst that ruptures can cause severe pain and internal bleeding. The larger the cyst, the greater the risk of rupture. Vigorous activity that affects the pelvis, such as vaginal intercourse, also increases the risk of rupture. Okay. Now I will tell you about some preventive measures of ovarian cyst. Well, although there is no way to prevent ovarian cyst, regular pelvic exam helps ensure that changes in your ovaries are diagnosed as early as possible. Be alert to changes in your menstrual cycles, including unusual menstrual symptoms, especially ones that persist for more than a few cycles. You should talk to your doctor about the changes that concern you. Okay. Now I will tell you about the diagnosis of ovarian cyst. When when the patients comes to us, okay, usually a cyst on your ovary can be found during a pelvic exam. Depending on its size and whether it is fluid filled, solid, or mixed, we likely will recommend a test to determine its type and whether you need treatment. Possible tests include pregnancy test. A positive test might suggest that you have a corpus luteum cyst. Pelvic ultrasound, and that is a band-like device, transducer that sends and receives high-frequency sound waves, and these are known as ultrasound, to create an image of your uterus and ovaries on video screen. Your doctor analyzes the image to confirm the presence of a cyst, help identify its location, and determine whether it is solid, filled with fluid, or mixed. Laparoscopy. Using a laparoscope, that is a slim lighted instrument inserted into your abdomen through a small incision, your doctor can see your ovaries and remove the ovarian cyst. This is a surgical procedure that requires anesthesia. CA125 blood test. Blood levels of a protein called cancer antigen 125, that is CA25, often are elevated in women with ovarian cancer. If your cyst is partially solid and you are at high risk of ovarian cancer, your doctor might order this test. Elevated CA125 levels can also occur in non-cancerous conditions such as endometriosis, uterine fibroids, and pelvic inflammatory disease. Okay. Now I'll tell you about the treatment of ovarian cyst. Well, treatment depends on your age, the type and size of your cyst, and your symptoms. We might suggest watchful waiting. In many cases, you can wait and be re-examined to see if the cyst goes away within a few months. This is typically an option regardless of your age. If you have no symptoms and an ultrasound shows you have a simple small fluid filled cyst, your doctor will likely recommend that you get follow-up pelvic ultrasounds at intervals to see if your cyst changes in size. Medication. Well, sometimes we may recommend hormonal contraceptives such as birth control pills to keep ovarian cysts from recurring. However, birth control pills won't shrink an existing cyst. Surgery. Your doctor might suggest removing a cyst that is large, does not look like a functional cyst, it is growing, continues through 2 or 3 menstrual cycle, or causes pain. Some cysts can be removed without removing the ovary, that is known as ovarian cystectomy. In some cases, your doctor might suggest removing the affected ovary and leaving the other intact, that is known as oophorectomy. If a cystic mass is cancerous, your doctor will likely refer you to a gynecologist cancer specialist. You might need to have your uterus, ovaries, and fallopian tubes removed, that is known as total hysterectomy, and possibly chemotherapy or radiation. Your doctor is also likely to recommend surgery when an ovarian cyst develops after menopause. Okay. Well, this was my video about ovarian cyst. I hope you like this video. If you have any question about ovarian cyst, you can ask me in the comment section.